Hey, how's it going? My name's Andrew Schmidt. I'm a student physical therapist with the University of St. Augustine. Can I have your name and date of birth really quick?
Martin Felice, August 15, 1975.
Okay, cool. And can I just check that on your bracelet? Yep, awesome. So according to my chart, you're in here because you have some facet impingement in your cervical spine. Can you just tell me a little bit more about that, like how it happened?
Man, I was like rollerblading and I fell and I fell on my neck and I just felt like this sharp pain going down, but I don't feel that anymore. But right now it's just like all in this area here.
Okay.
It hurts a lot.
Yeah.
I can barely like move my neck around and stuff. So.
All right, that's got to be really frustrating. I'm sure it's like kind of keeping you from getting back to rollerblading. How would you rate that pain on a scale of 1 to 10?
Scale of 1 to 10, I would rate it like an 8 right now.
An 8?
Yeah, so it's super painful.
Okay. Let me just kind of go over some precautions and contraindications for the treatment that I think you might be indicated for. So do you have any COPD, any claustrophobia? Have you been diagnosed with rheumatoid arthritis, osteoporosis?
No.
Okay, great. Because what we're going to be doing today is we're going to be doing traction therapy.
Okay.
Basically, what your diagnosis is telling me is that your vertebrae are kind of a little bit closer together than we'd like them to be, so the joint space is closed, and that's kind of causing that rotation that you were telling me about. So traction is basically we're going to be elongating your spine in a very gentle manner, of course. And this is going to kind of allow those joints to breathe a little bit more, kind of gap the joints. So you'll hopefully have less pain and less muscle guarding perhaps, as well as kind of more range of motion. All right. Any questions before we begin?
No, you've been great.
Okay, cool. So what we're going to do is if you're comfortable, if I could have you take off your shirt.
Sounds good.
Okay, great. Just have a seat right here. We're gonna prop your feet up on this table.
Sounds good.
Flip it over for you. Great. And we actually want you to be at a 90-90 angle, so I'm gonna move the seat a little bit closer. So, let's move it just a little bit closer still. All right, excellent. So what I'm gonna do is I'm gonna hook you up to this machine. And it's basically going to kind of pull back a little bit, and that's going to be what's elongating your spine. So it says in your chart you're 190 pounds?
Yes, I am.
Okay, great. So that means that we could kind of pull at 20 pounds, like we'll have 20 pounds of pull on your neck. That sounds like it might be a lot, it's actually not, and it's going to be a very gradual pull. Basically what's going to happen is there's going to be 30 seconds of pulling and 30 seconds of relaxation.
Okay.
Additionally, we have this kind of put at an incline of 20 degrees, and that's going to kind of target that middle cervical spine, which is where you were complaining that you had all the pain and the motion restriction. Any questions?
Great.
All right, awesome. So we're going to start this. Let me just hook you up right here. The treatment time is going to be about 15 to 20 minutes. I'll come in and check on you periodically. I'm also going to leave you with a call bell, as well as this button. What that's going to do is if you feel any dizziness, any discomfort at any time, just give that button a press.
Okay.
And the machine's going to stop automatically.
Okay.
Okay?
Sounds good.
Any questions before we begin?
No.
Okay. All right, so we're beginning. Okay. So right now it's pulling at 2 pounds, and like I said, it's going to kind of gradually go up to about 20 pounds. All right. I'm going to go check on some other patients, and I'll be back in 5 minutes, okay?
Thank you, Andrew.
All right. It's been 5 minutes. How are you feeling?
Feeling good.
Yeah.
Feeling a little bit better than when I first came in.
A little bit better?
Yes.
Cool. Awesome. No dizziness, nothing like that. You're not feeling like claustrophobic?
No, not at all.
No, like, oh my God, get me out of here.
No.
Okay.
No, not at all.
Awesome. I'm going to go once again check on some more patients. I have a lot of them. I'm a very good physical therapist. So I'll be back, okay? And when I come back, we'll stop our treatment, and then we can move on to other things.
Sounds good, Andrew.
Awesome.
Thank you.
All right, so I didn't hear any shouts of pain coming from here, so I'm guessing we're doing pretty good, but how are you feeling?
Better than 5 minutes ago.
Better than 5 minutes ago. Okay, cool. So it's been about 15 minutes. I think we can stop since you're feeling pretty good. So we're just gonna stop this, and then we can move on to other modes of treatment. Just gonna disengage this clip right here. There we go. All right, so you can sit up for me.
Okay. Thank you.
Yeah, no problem. All right, so I'm doing this post-treatment skin inspection. Everything looks good. And yeah, how you feeling?
Feeling good. Feeling much better than before. I would say that scale you gave me, I'm like at a 0 to 1 to 10 scale. I'm like at a 2 right now.
Okay,
so
great.
My 8 to a 2 is pretty
You
good.
took the words right out of my mouth. I was
did.
going to ask you how your pain was.
I know you did.
You've
yeah.
done this before, haven't you?
Well, yeah, a long time ago, yeah.
Cool.
But
So it seems like the traction worked. What we're going to be doing now is we're going to be kind of moving on to actual like resistive exercises and stuff. Next time, if you come in and you don't want to do the traction, we could also do some manual release, as well as some kind of resisted isometric movement, or exercises as well. That'll kind of decrease any sort of muscle burden you might be having. Do you have any questions?
no, you've been great, Andrew.
Cool.
Thank you.
Thanks, man.
Thank you so much.
All right, let's get to it.
Feel better.
Feel better.